And like you said, every case is going to be different when it comes from a diagnostic standpoint. So that's why it's always important to get the right diagnosis in the beginning, because we don't want to be going back and having to change something at a later date because they didn't heal properly, and now everything's just muddled and screwed up. So diagnosis is important, but also too when it comes to treatment, everyone's going to respond a little bit differently. Everyone lives a different life. They work different jobs. They have different amounts of kids or no kids, and different things can irritate or aggravate those types of injuries too. Yeah. So sometimes it's also finding out that, hey, you know what, we're still in pain, but we've reached permanency at this point. And that's important too, but we have to make sure it's defined as to what is permanent about it, and make sure we rate all of those things, because then it gives you, the attorney, the leverage to know, okay, we're not talking about getting better, we're talking about maintaining at this point.
Right.
And that's a totally different thing too. So there's a whole medical side, because you really should never be settling while you're treating.
No,
that doesn't make any sense.
I will never settle a case until a client is either at maximum medical improvement or they're done treating. Period. Yep. I'm not going to do it, no matter how much they want me to settle it.
Right. And that's from a client's best interest, because you don't really know what the overall injuries are going to be, because you could be progressing well. Even let's say you have a partial tear of a labrum, you're progressing well, and then all of a sudden you just hit a wall, or it's re-aggravated through something you're doing in your everyday life, and now you end up needing surgery. If you would have settled before, none of that matters anymore.
Yeah, I just handled this exact case where the client had a torn labrum, but she didn't want to go through surgery. And the insurance company offered $38,000 to settle it before we filed a lawsuit. We filed the lawsuit because she was continuing to go through her treatment. She gets the surgery, and we ended up settling it for over $300,000. So the value of cases changed dramatically based on where you are in the timeline. And if you really try to rush it, that's what the insurance company wants. They want to rush it, so they pay $38,000, which is still a lot of money, but it's a lot less than $300,000, which is what they should have paid and ended up paying.
Yep.